Thanks for listening. If you'd like to schedule a one-on-one coaching with Dr. Lodhi, please visit drsadaf.com. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodhi, and here with me today is my sister Rafia. And this episode is everything you need to know about puberty in girls. So before I get into it, the very first thing I want to make very clear is that I am not giving any type of medical advice. So if you have any concerns about your health or the health of your little girls or somebody going through puberty, please speak with your medical provider. And if you have any questions about your religion, please ask your friendly neighborhood religious leader. It's the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So I am going to get right into it. Today is a very exciting topic. And Raf, I know that you and I had talked a little bit about our kids getting older, and maybe you can just talk a little bit about your experience, and then we'll talk about the medical aspect of it.
So, as you know, I have girls, and there's a lot of hormones floating around in the house currently because a few of them have started their period. And what comes along with that is a lot of emotions, a lot of tears from them and me, because sometimes I can't handle the crying all the time for no reason. No reason, they're just crying. I'm like, I know I've been there, but it's been so long. And I feel bad for my husband because he's outnumbered, and the hormones are probably driving him, I don't know. He just laughs, which is a good thing. And he just shakes his head. And, what can he do, poor guy? So, why don't you tell me what I can expect from girls about to hit puberty and going through it right now?
Yeah. So, I mean, so it's funny because you have 3 girls and I have 3 boys. So our experiences are definitely very different.
Mm-hmm.
And so my next podcast actually will be talking a little bit about puberty in boys. But today we're going to focus on girls. And you do have a great husband that is willing to handle and be very patient with the 4 women in his life. So, all right. So just puberty for girls. So, basically there's different stages that girls go through, and they are named for the people that came up with the stages. And it's Doctors Marshall and Doctors Tanner. And it's called the Tanner stages. But and each different stage has tells you kind of what's going on in the biological and the physiological aspect of a girl and also a boy's, and it also describes kind of what you'll see. So what a little girl could expect, and as she gets older. So I'm just going to kind of talk us through it a little bit, and then you can tell me about kind of what your experience has been. So puberty. So before puberty, like pre-pubertal, kind of this talks a little bit about what the body is getting ready for, and it usually starts around age 8. And what happens is that the brain begins to send some signals to the rest of the body, and it starts to prepare for the changes that are going to happen. So in women and also a little bit in men, one of our biggest, I would say, pathways is from the brain down to a gland, actually in our brain as well, called the pituitary gland. And then from there, we get hormones, and those hormones will act on the gonads. So for women, for girls, it'll be ovaries. For men, it'll be their testicles. And and what happens then is that different features start to present in the body that we may see. And so, for example, what happens at the beginning is in the brain, there's a part of the brain called a hypothalamus, which releases a hormone. It's called the gonadotropin releasing hormone. And that signals the pituitary gland, which is a gland in our brain. And that then releases hormones. And for women, or for girls, there's two really big hormones. They're called follicle stimulating hormone and luteinizing hormone. And these two hormones affect the ovaries, and they get the body, they get the uterus ready for implantation of a fertilized egg. And if that happens, then the woman or the girl gets pregnant. And if that doesn't happen, then that tissue that builds up within the uterus will shed. And then that shedding, as we know, happens every month in somebody that has a regular cycle. And if their periods are irregular, then the cycle can be either shorter or longer. And or they can be completely irregular, and a person can get a period, say, every few months. So, but also the other things that are really important to note is that with puberty, you'll get breast development, and then you'll also get the pubic hair development. And in the beginning, really what happens with the breast development, what we talked about, when the brain starts to prime itself, prime the body for these type of changes, initially there's no breast development that happens yet at around age 8. And we'll talk a little bit about sometimes people have what's called precocious puberty, which is they start to go through puberty early. Because the usual time frame for a little girl to go through puberty is typically between the ages of 9 and 11. That's when they start. But if it happens earlier, so for example, some of the studies have shown that what we refer to as precocious puberty is just the onset of puberty before the age of 7. Now, they've divided it into white girls and African Americans, but there's some controversy with that. But I'll just tell you what the books that I've read have said. So they call precocious puberty as the onset of puberty before the age of 7 for white girls, and for before the age of 6 for in African American girls. And that's why if you notice something like that starts to happen, where you start to get breast development and hair development in a little girl, then it's very, very important that that parent or that caregiver go and see a physician, so that, to make sure that there's not some type of tumor or something that's causing that child to go through puberty early on. Okay. Also, there have been studies that have noted that obesity can also trigger a child to start to go through puberty a little bit earlier. Um, so, basically that's what happens in the beginning. So this is what we talked about, was a child around the age of 8. Now we're going to talk about somebody that's a little bit older, I think, where some of the girls actually start to go through puberty, which I talked about, where ages 9 and 11. And this is where the physical changes will actually start to begin, right? So that uterus will get a little bit larger, the height increases, right? So that's also something that's very important. And I didn't mention is that there is an acceleration in height. And sometimes that's the first thing that we notice, is that the girls start to get taller, the boys start to get taller. Also, what we notice during this time is that there's breast development. So they're called buds in the beginning, and they start to form under the nipple, and they can be a little bit itchy or tender, or one maybe a little bit bigger than the other. And the area around the nipple starts to also get a little bit darker. You start to notice a little bit of the pubic hair, which may be straight or slightly curly. And then this starts to appear around the labia. And then stage 3 is where you actually get a little bit of a growth spurt, right? So this usually happens around age 12 or a little bit after that. And the first things that you may also notice aside from that growth spurt is that the child starts to develop acne,
Mhm.
right? So it might be on the face, on the back. The skin becomes oilier, and the fat starts to accumulate on the hips and the thighs in girls. And they may also start to get body odor, right? So that's something that happens.
Body odor, yes. Please use deodorant, little girls. Please, please.
Absolutely. Yes, and little boys for sure.
Yeah.
Um, and at that time, in terms of like the breast and the areola continue to enlarge, and there's no separation of contour. So basically, the breast just starts to develop, and then they start to get more pubic hair.
Mhm.
So it can be darker and coarser, and now it's spread over their pubes, and the hair starts to also form under the armpits. So these are, things, and this is what would they consider like Tanner stage 3. So what I've been going through are the different stages. Like I said, there's 5 stages of these Tanner stages, and so we talked a little bit about the first one. The second one is when the child is between 9 and 11, then they begin, and the third one is when they start to get the armpit hair and acne and things of that nature, and they get the growth spurt. Stage 4 usually starts around age 13. And again, this is typically when girls will start to get their first period. And it can begin between the ages of 12 and 14, but for some, it happens a little bit earlier,
Mhm.
right?
Definitely.
Um, and some girls that have perhaps anorexia or some disordered eating actually will start a little bit later. Um, and we talked before about this, but again, what causes a period, and basically a period is caused by hormonal changes. And what we talked about before is, the hormones cause the lining to build up, and if there's no pregnancy, that lining will shed. A lot of times, that blood that comes out will seem like it's a lot. And the first 3 days are typically the heaviest. And then that bleeding tapers off. So for some women and some girls, that period will last like 5 days. And for others, it may last like 10 days, right? So the lower end of the cycle for the menstrual cycle, what we say is about 21 days, right? So from the start of one period, so those are women that have shorter periods, shorter period cycles. So the start of one period to the start of the next is 21 days. That's the lower limit. And then there are some women that have longer cycles, like what we call 35 days. So from the start of one period to the start of the next, it could be 35 days. Now, there are, of course, girls and women that may skip months, right? And so that happens typically when a woman doesn't ovulate or if a girl is not ovulating. And that happens a lot in young girls, right? During puberty, where they may get a period and then for a couple months, they may not get one, and then it happens again. And that happens because that neural pathway that we talked about from the hypothalamus to the pituitary down to the ovaries, and those neurotransmitters, or those hormones, right?
Mhm.
That whole pathway is a little bit immature. So it takes about 2 to 3 years before girls start to get regular periods where they'll get like a period every month. So that's also important to know, is that if you have a girl that's starting to go through puberty, that her periods may be irregular for the first few years.
Good to know.
And like we talked about now, in terms of what to use, for a period, there's different things that a girl can use. I know that, of course, there are pads, which are probably the easiest for somebody to use, especially a little girl that's just getting her period. Pads are probably the easiest thing for
Mhm.
them to use. There are also underwear. I don't know if you've seen that.
Yeah,
Have you seen
thanks.
that?
Thanks, underwear.
Yeah.
Yeah, yeah.
Yeah. So, by the way, this podcast is not sponsored by Thinks, but
If
yeah,
you
there
want to
is.
call you, go ahead.
Yeah, that's right. But there is underwear that
Mhm.
people and girls can use
Mhm.
during their period, and that is probably the most environmental friendly, right? Because it's reusable, you can wash it, um, and you just have to feel comfortable wearing an underwear that is absorbing that blood.
Hmm.
Also, you have those menstrual cups that girls can use, but they have to really be comfortable putting a cup inside of the vagina to
Hmm.
collect that blood and then take it out. And you have to, of course, rinse it out and then put it back in. So you have to feel really comfortable doing that, putting that in and out, taking that in, putting that in and taking it out.
I
Yeah.
think for little girls, the cup might not be the easier way to go because they're just developing and they're not sure of themselves and trying to put something inside. I think the pad, that's what we do. We just pads our way, you know, with wings.
Yeah.
With wings,
Yeah.
always.
That's right. You're right, Ralph. I think it's definitely requires a lot of comfort
Mhm.
with your own body and your anatomy, right?
Yeah.
And for little girls, that's probably not the easiest thing,
Hmm.
but it's whatever works for people.
Yeah.
And of course, there are tampons, right?
Yeah.
And again, like you said, again, for somebody just starting out that are not comfortable with their body, that again may not be the best option for them, but they can always go to their gynecologist and be shown how to put in a tampon and how to take a tampon out. So that's also important. And tampons are helpful with, playing sports. That might be helpful. And also
Swimming.
definitely swimming,
Yeah.
right?
Yeah. Yeah.
So that's really key. But it's whatever the girl feels comfortable with, and if she's understands and
Yeah.
knows her body, then she can definitely use whatever works.
Yeah.
Um, so at this stage, what we talked about, aside from just the period happening, is the breast development that happens. And at this point, which is the 10 or stage 4, is that the breasts take on a fuller shape, passing the bud stage. And this is where the areola and the papillae also elevate above the level of the breasts, and they form the mounds for further development of the breast tissue. And basically, now in terms of like the hair development, the pubic hair development, distribution is similar to that of an adult, right? But decreased in the quantity. And then the final stage, which is that 10 or stage 5, the periods start to become more regular. So they're, happening typically every month. And like we said, it can take a few years before they actually become regular, but by at this stage, they will become regular. And the height during Tanner stage 5 is they reach their full adult height, and the breast development is now mature. They'll have what they're going to have as an adult, and the pubic hair is now more spread out a little bit, sometimes on the inner thighs as well, and definitely covering their appearance will be that of the inverse triangle, which is classically the feminine type. So that's basically it, right? So I think the big takeaway is that if puberty does not develop by the age of, they say, like 14. If a girl actually here, so I have it right here. So delayed puberty, girls who fail to develop any secondary sex characteristics by the age of 13 and no period by the age of 15, or have not gotten a period 5 or more years after the onset of different puberty characteristics, right? So, say like they're developing breasts, they're developing pubic hair, they're developing armpit hair, but they haven't gotten a period, right? In 5 years since the time that they started developing other features, you should definitely have that checked out by your doctor, right?
Hmm.
And or if they haven't started to develop any characteristics by the age of 13 and no period by the age of 15,
Hmm.
then also that should be evaluated and checked out by their pediatrician or a gynecologist, so that if there is anything going on with the child, that can be picked up early on.
Hmm. So I have a question. So if a girl starts her period early, how does that affect her height? Because I've heard, I don't know if it's a wives' tale or not. Like if the earlier she gets her period, she might not be as tall. What do you say about that?
So I'm so glad you asked, Rafia. So the final adult height is typically reached between 1 and 2 years after a girl gets her first period. So most girls get their peak height by the age of 16, but some actually continue to grow until the age of 20.
Okay.
So, yes, in terms of, reaching their final height, it is true.
Okay.
Yeah.
Okay, and when you were talking about tampons and having on your OB-GYN help you, you can probably find one of your friends who can help your daughters insert them. Because sometimes the mom just can't do it. You might need a
Yeah.
friend to help you do it. And so
Yeah.
that's from personal experience.
Yeah, no, definitely. I mean, if you're not sure or whatever, it's always great to ask for help,
Yeah.
and especially if somebody knows and can teach, I think that that's a great option,
Mhm.
right? And if the child say doesn't feel comfortable going to a gynecologist just yet because they're small,
Yeah.
right? They're young and they just are not that comfortable. And I think that having confidence in your own body and in yourself takes time. And puberty is probably a rough time and in people's lives for most people. I know it was in mine.
Yeah.
And so if you have somebody that you can ask or talk to regarding placing a tampon, I think it's very helpful,
Yeah.
and it would be great. Yeah.
So another thing that we didn't touch on are cramps. When the little
Mm,
girls get the cramps, you feel helpless because you can't help them in any way, probably just give them a Tylenol or anything. And so one of the home remedies that we used growing up, mom would always make us warm milk and honey. And I
mm,
don't know if it was just a warm milk or what, but that always helped. Always, always helped.
yeah. Does that help your girls?
They don't like warm milk. They're
Yeah.
used to
I
cold
think it
milk.
requires.
They're used to cold milk, and so when I try to warm it up, so just have to give them something else, Tylenol, ice pack, heating pad. Those really help.
Yeah, I think that it's an acquired
Yeah,
taste. Um, so I think the
I know. I mean, I love it. I love it, and often, as you know, warm milk will put you to sleep, and so I think maybe that helped as well. And so
yeah, yeah, absolutely, absolutely. Yeah, I think that not everyone likes warm milk and honey, so for sure. Um, so how are you girls doing?
they're dealing with it. I think because the older one because the middle one started early, it was helpful that the older one had it, so she can ask questions. Like if she didn't want to ask me, she can always whisper to her older sister, like, what's going on? And then when I come in the room, they're like, nothing. But it's good that they have, like, they can tag team, they can ask each other questions and stuff like that. Obviously, I'm there whenever they need me. They're always like, Mom, where are the pads? We need pads. I'm like, okay, you know. So at least we had that open dialogue, growing up. Um, when I told mom when I started, mom looked at me like, oh no, she didn't say anything. She said, under the sink. I'm like, okay, that's not where I knew where the
Yeah,
pads were. And so at least we
yeah,
have we have an open dialogue where we can talk about it a little bit easier, and we keep that topic. I mean, it's always been talked about in the house. It's very open, which is good 'cause we have that open communication right now.
that's awesome. Yeah, I think that's so important, right? Is to have that open communication.
Yeah.
I'm just thinking. So, Rap, what was your first experience when you got your period? What was that like? I
Mine.
don't think I knew. I was much younger. Well, I'm not much younger,
Yeah,
but I was
well, you
definitely
you
younger.
are much older? No, no, younger. Um, no, I didn't even know what was happening. I mean, I kind of knew because, older sister kind of knew what was going to eventually happen and had friends. I mean, it was a topic of conversation in middle school. Oh, I started, you started, and I'm just sitting there. I started a little bit later, and the first time I had it, the pain was intense. The cramps, I remember the first few years, the cramps were really, really intense.
Yeah,
But
yeah,
they've subsided much more since after having kids. They've gotten better. But initially it was really the cramps that would just have me just curled up in a ball. You know what I'm saying? But it was fine growing up. You just have to be careful. Just as a girl, at nighttime, you don't want to leak. And then you have to be always careful. Like at school, you don't want to leak. And, it's kind of a stressful period in middle school, high school, going through that. I mean, high school itself and middle school is terrifying in itself. And to leak in school, oh my God, that will live with
Yeah.
me, forever. And so just have to be very
Yeah.
careful. Yeah.
Yeah, I remember, having you and Appa, as the two older sisters. And so when I got my period, I was 13,
Mm-hmm.
and I was on a trip with Shanaz and Amina and Shabnam, and we were in Tennessee, and
Dollywood, right?
yeah, Dollywood and Pigeon Forge. And I got my period. And I remember telling Shanaz, I was like, oh, I got my period. And she thought it was just, like the regular. But I was like, no, this is the first time. I was so proud. And then
The rite of
and I
passage,
was,
definitely.
I know, right? And then I called up, I think I called up mom, and I was so proud to tell her that I got my period and I needed a pad. And mom was like, okay. She didn't care. I was so sad that it wasn't that important to her, but it was so important to me because, I had older sisters that were already going through it, and I wanted to be part of the team and
You
part of the
wanted to be
club.
mature, Sadaf. You wanted to be mature.
I wanted to be mature. That's right.
Yeah.
So, but anyways, yeah, I think I think it's the way that you're raised, and I think it's so important to make it a positive experience,
Yeah.
right?
And it's very cultural. Like mom not saying anything, I think that's very cultural,
Yeah.
because, if mom didn't have any sisters, so like, except so only
Yeah.
brothers, so you know what I'm saying?
Yeah, I think it also has to do with how comfortable you feel about the topic,
Yeah.
right? And how open you want to be. And in definitely in mom's generation, I'm sure they didn't talk about things like that. Those kind of things
Yeah.
were private topics, and perhaps even, maybe shameful or something like that you didn't discuss out in public. And you really didn't have very many to talk, very many people to discuss it with, right? That's why we're trying to, you and I and a lot of people, our generation, are trying to change that narrative so that, girls don't feel ashamed when they get a period, right? And that they are raised in a more positive environment, so that they can ask those
Yeah.
questions that they may feel a little bit inhibited about asking, and can find the resources that they need.
Yeah.
So,
So we
yeah,
actually
I think,
celebrated, quote unquote, celebrated when the girls got their period. And one of our friends, super sweet, she made a basket for my older one. She put like pads, liners, medicine in there for her. She made a huge basket, and it was really sweet for her. So it's, again, we're not trying to like make it something that they should not talk about. It should be like celebrated, and different cultures celebrate it differently, and so I just want to be open with my girls about it. Like, there's something that you can talk to me about. Come to me at any time. We can discuss these things. And so,
yeah,
yeah.
absolutely. So, all right. Well, I think we are done here, and it's been real and really intimate. And remember, this is not meant to be any type of medical advice. So, if you have any questions or concerns about your child and puberty, please see and speak with your healthcare provider for any concerns. And until next time, this is the Muslim Sex Podcast. Thanks for listening. If you'd like to schedule a one-on-one coaching with Dr. Lodhi, please visit drsadaf.com. And until next time, this is the Muslim Sex Podcast.